I'm Samantha Latshaw. Welcome to your hometown Health Connection. As more Americans across the country receive the COVID-19 vaccine, there are more questions. There is growing concern on how the current vaccines on the market protect against the new strains popping up across the world. Right now, there are 3 circulating in the United Kingdom, in Brazil, and South Africa. Experts say some are more contagious than the original virus. We know you're curious about the safety of the vaccine and its effectiveness. Here to answer all your questions surrounding the pandemic is Dr. Kenneth Snyder and Dr. Raul Vazquez. Doctors, welcome. Thanks for joining us. People who perhaps have had a brain injury or have suffered a stroke, are they more likely to have neurological problems with COVID? And would they be more prone to chronic migraines, to be put more at greater risk for long-term problems with headaches and other issues?
Yeah. So again, a very complex question. The neurologic system, once it's had any injury and learns and has recovered from it, with almost any insult, you can revert back and see those symptoms. So somebody that's had a severe stroke and recovered, if they have a urinary tract infection or a fever or a cold, it almost looks like some of the stroke symptoms can come back. So there's a exquisite sensitivity to the neurologic system. The other unique component of the neurologic system is our body's immune response doesn't always get in there very well. Similar to how when we get chicken pox, it lays dormant, but at a period of time, it can trigger and do shingles at some point. And so there's an element of that we don't know 100% about. And as well as the body can learn to fight the virus, but actually trigger an ability to fight itself. It's called autoimmune disease. There are so many longer-term neurologic consequences about this that the NIH actually started a neuro-COVID tracker of just collecting the database of all these cases to learn from. And so I expect us to learn a great deal more about the neurologic sequelae or consequences of this virus. That said, I expect people with previous neurologic disease to recover the same way they would from any other virus or other things that they've had, which is they feel some of the symptoms of their prior neurologic problem more during the illness, but then recover, even though it may take a little bit longer than other people to recover from. I don't see anything that would expect migraine to continue or get worse, but more data to come.
Right, there's a lot of documentation of long haulers that tend to suffer from headaches and many other symptoms long after COVID, recovering from COVID.
Exactly, and what we're finding in some of those individuals is they have autoantibodies that have developed. So a lot more to learn there.
Dr. Vazquez, can I get the vaccine at my primary care provider's office?
I mean, we're not all equipped to do this right now. I think I always think of primary care as the Marines. You have a ground war, you got to use your Marines. So really a lot of family docs and pediatricians, we've been giving vaccines forever. I've been giving vaccines for 30 years. We give about 400 to 500 vaccines a month. So it becomes real important because you already have the infrastructure to give the shot, report it, and all that, and then the follow-up. Now the timing, is everybody going to make the 28th day? No, you may run into 29, 20, 30, but at least you can, we'll be able to manage that and make sure that the individual gets a follow-up vaccination. But I believe, primary care is attached to public health. And what we do is vaccines and diagnostics like COVID testing. That's what happens in a primary care office. And I think we have to go back to doing a lot, especially during the COVID time. We went back into primary care where if you were sick in the old days, you stayed home. We basically managed you from home. And that's what we did during this COVID experience. It's going back to these vaccines are becoming really, really important. And so I run a lot of value-based agreements and look at quality metrics across the state. And what we find is that vaccinations are still not there across primary care offices, hospital clinics, FQACs. The numbers are not where they need to be. And this may be an opportunity to kind of really reinforce primary care to go back and vaccinate people, especially during this time of need.
I had mentioned earlier on and appreciated and thanked Dr. Vazquez for his leadership in being one of the 400 sites in Western New York, and it's his leadership and willingness to do this that have allowed us to get about 133,000 vaccines into our Western New York area. There's about 1.7 million for all of New York. The local hub that Dr. Nancy Nielsen, Dean Kane, Gail Burstein, and Mark Sullivan, Catholic Health, are helping distribute, learn to distribute to those sites, are making a tremendous impact. But Dr. Vasquez's leadership in making sure minority communities are vaccinated is critical, and we can't celebrate that or be more appreciative of that effort and that work.
Thank you.
Dr. Snyder, can I get the vaccine if I have allergies? Also, if the patient has a history of vaccine anaphylaxis, could they benefit from perhaps a pre-treatment prep such as Benadryl, Pepcid, or prednisone?
So you're exactly right. It's that 1 in 100,000 severe allergic reaction that we've seen with the mRNA vaccines, Moderna, Pfizer. We haven't yet seen in the J&J and the others. We're not sure what the cause is. It may be from something called polyethylene glycol, which is in a lot of medicines that helps keep the vaccine able to stay stable and work. There are no significant preservatives in any of these vaccines, which is why they need to be so cold. That conversation and data has been worried or translated to be, wait a minute, if I have a food allergy, do I have a problem? No. If I have any other allergy, do I have a problem? No. It's if you have an allergy to prior vaccinations, because it may have contained some of that element, we need to pre-medicate you and watch you closely. Almost all of the severe reactions, if they occur, would occur within that very early time frame. The fact that we're so far out from these trials, these started in July of 2020. Almost every serious adverse event that we've seen in any vaccine occurs within 2 months. There's also been a lot of talk around the physician that passed away from low platelets down in Florida. Was it related to the vaccine? It is so difficult to tease out whether a ultra rare event could have occurred from a vaccination versus how frequently does it occur in nature. So that individual case, just because it got so much publicity and been talked about so much, was somebody that had no platelets weeks after a vaccination. Single event, single case. And remember, we've done 33 million vaccinations. The natural history of what's called ITP, or loss of platelets, is 9 out of 100,000 people. So could that have been a random event that happened after a vaccine? It's possible. It's a horrible story, and any death is. But when we think about vaccine-related side effects, we need to put them in the context that people have heart attacks at a certain natural rate, unrelated. People have other things that cause them to die, unrelated. And we're seeing no difference between the placebo arms and the vaccination arms to suggest that they're vaccine related. It doesn't mean we're not going to keep learning. And after 33 million doses, we've got 330 million people in this country. As we continue to get to everybody, we're going to continue to learn more.
And I want to piggyback on that. So Dr. Snyder said it. After your second dose, if you're free and clear 30 days out of that, that's when we normally see any type of side effect. I mean, if we give a flu shot, there's a condition called Guillain-Barré. We're going to see it in that timeline. So you're out over it. Now, we vaccinated close to 1,200 people by today, and about 5 to 7% of these individuals had allergic types of symptoms. They're on EpiPens. They get, allergy shots. And, knock on wood, we had no reactions. You just have to watch them closer. And if they start to get symptoms, check their pressures. If things look, you hit them with an epi and stabilize it. But we have not had to have that occur. I don't want people, because that often happens is, well, I have allergies, so I shouldn't take the shot. Listen, COVID kills. The shot, we may get into a little bit of a situation and stabilize. But after, like I said, 33 million, I think there were 29 reported like severe reactions, and nobody died out of that. That's versus 450,000 deaths. I think you got to start weighing the benefits risk of these vaccines. But allergies should not be, in some cases, just the doctors need to know. We, like Dr. Snyder said, we can pre-medicate, prednisone, and Benadryl, things like that prior to it. But we have not had any issues with that particular group of patients.
Absolutely. Weighing your options between a high possibility of death and perhaps an allergic reaction. Now, is it safe to say that a lot of these allergic reactions are more so from let's say, the stabilizer in the actual vaccine as opposed to the components that make up the vaccine?
I hinted at it before, and we don't know because there's really not much to these vaccines, especially the mRNA vaccines. The mRNA vaccines have a little lipid bubble, which is a little kind of soap bubble, with the RNA inside of it, and a element called polyethylene glycol, which is in almost every medication or in a lot of different medications. And that's it. A little bit of saline or salt. There's nothing, there's no preservative that's in it, which is why they wanted to keep it so cold. It doesn't mean that that vaccine wouldn't be stable at higher temperatures. They didn't want to take the chance, and were trying to get the data as fast as they could with as pure of a product as they could. And so we will learn as we look at subtle differences in the other elements of the other vaccines of whether or not that component could play a part. So we don't know the answer yet, but think of how rare what I just described was. It's less than 1 out of 100,000 people. And so we need a series of those, and a series of those within the different vaccination groups to start sorting out statistically what could the component be. And we just don't know that yet.
Interesting, because a lot of people are shocked when they hear how cold this medication has to be kept. And it seems to be because of there not being so many preservatives, as you mentioned.
Correct. They got to try to preserve its structure. Yeah, because, you know, you've got a certain timeline. You know, this is why it's so difficult. The Moderna, you've got 10 shots that have to be used within a 5-hour period. The Pfizer, the same. So and that's exactly what it is. It's got to be, this system keeps it stable, but after that, it breaks apart. It won't be as effective in the trial like it was in the trials.
Dr. Vasquez, people with dementia and Alzheimer's disease are being greatly impacted by COVID-19. Mm-hmm. What services are available for them, and what are you doing to help them in your practice?
Well, I mean, you know, we manage the conditions that these individuals have, and I think we got to make sure that, again, that they get vaccinated. That's real important, and because we found, like Dr. Schneider said, that over the age of 65 to 75 to 80, exponential deaths drastically rise. And in the nursing home, you know, we have a lot of individuals with dementia that are often, you know, that were a part of the 1A to really try to get these individuals vaccinated. So a lot of the supported systems, I think the caregivers, because it's a lot of work to do that, trying to find ways to kind of, you know, make sure that somehow they get on the line to be vaccinated, that would be quite helpful. But you're pretty much just managing the disease and making sure that these preventive measures are working around the patient.
Dr. Snyder, this next question comes from actually another doctor here in the local area. I have a patient undergoing gamma knife brain radiation therapy. Will this affect the COVID vaccine immune response?
I wouldn't believe so. Dr. Vasquez brought this up earlier. Any chance you have to get vaccinated, you get vaccinated. And getting vaccinated will not likely slow down any other things that need to happen in your life from a criticality, whether it's surgery or anything else that you have going on. So unless you're really within that few-day period of feeling the effects of your body responding to the vaccine, I wouldn't expect any consequence at all.
Would you like to add to that, Dr. Vasquez?
No, I agree.
Okay, what about any efforts being taken to build trust in the vaccine among the communities of colors? How are you addressing that in your practice?
I think for me, it's been my passion, because I've been down in that area for 30 years. What we try to do is we had a town hall meeting with the staff, and then we went over a survey. The survey was pretty remarkable. Well, 60% of people say that they weren't going to do the vaccine at all. So we try to, you know, have our pharmacists and basically describe what this vaccine was. Old tech, it's not new tech. It's trying to trick the body. It's not using a lot of the other vaccinations, because most people don't even get the flu shot in some of the community. So we were able to kind of get the mind frame worked around, and we didn't get the vaccines. I was lucky for Jericho and Myron Glick, Dr. Glick, that had 150 doses available. So when he told me that, and we had to go to Barton, which is a site, and the city mission. So we actually got our mobile unit together, and then we just took the teams. Now, initially I had to push people a little bit because they were just like, I'm not doing this. After the whole episode, and now we have about 95% of people, We had a town hall for the follow-up, and we put videos all over the place where the staff was actually happy. You know, they were scared. I mean, we talked them through the whole process, but having been vaccinated now, they're kind of okay, and they've become our ambassadors. On Friday, we have all 150 kind of going out there basically to show the community that, you know, if you have questions, these are the people that you have to talk to. And I think when you set up these pop-ups, that's what we did. Everybody talks, you know, because if you haven't taken the shot and then the patient says, you know, I'm getting the shot, if you take it and no, it's not going to help with the whole process. And just explaining the process is key. You know, when you get the shot the first time, you're just going to have arm pain. You may get these other symptoms, take Tylenol, Motrin. You're going to wait here for 15 minutes. If you have severe reactions, 30 minutes. Going through that whole described symptom, and then when you come back on the second shot, so when we took our second shot, everybody got tired. I mean, people were tired. Some people have muscle aches. Some people have fever for 24 to 48 hours. But because we told them to expect that, it was okay. And I think that transcends out to, you know, to what we have to make people aware that, you know, COVID kills. The vaccine, yeah, you might have a little reaction, but your chances of life, you know, I kept people alive. I think that's what I told them. I'd rather have you angry at me to keep you alive than not really follow through on what you need to do, at least going out. And if we want to get out of this pandemic, we got to get at least 75 to 80% people vaccinated. And those communities that were hit the hardest with COVID have a lot of mutations. So we talk about, you know, I believe there's about a 5% carrier rate within the area. And these individuals have had this. So if the US has 25% of the cases in the world, we have a lot of mutations here. Okay, I know we're finding them in elsewhere, but we're not doing a lot of gene sequencing here. So the faster we vaccinate, the less carriers, hopefully, and the less mutations are going to take place. And that's what I try to tell the community. So it's not just waiting on the side, saying, well, if I get it, you know, I'll just live with that, I'll take my chances. We really have to educate them that we're all in this together. And if we don't target those communities, no one's going to get out of this. We won't be out to 22.
Dr. Vasquez, what about the immigrant populations or new American population who have a language barrier? What are we doing to help reach those people who are English as a second language speaker?
Sí, pues yo hablo muchos idiomas. So we speak 18 languages. Ajiban, Jericho, the same. I think with Jericho's population, a lot of Burmese and Somalis. And what we found was the highest incidence of COVID among zip codes was among the Burmese. They had the highest incidence. So getting these communities educated and coming in for vaccination, it's working. I mean, today at the Father Bell, out of the 360 shots, I can tell you that about 250 were different groups, black and brown, a lot of Latinos, and we were trying to just relay the information so it's understandable. I think one of the things that happens with the Department of Health is a lot of information, but you're speaking one language, sign language, and then no one else knows what's going on. And I think what we try to do is bridge the barrier, the language barrier, and most important, health literacy. We have a lot of health literacies in these communities, and if we don't address or talk to the level that they understand, you're not going to be able to move that needle.
Absolutely, definitely meeting people where they are is the only way we're going to.
And the other thing too is really trying to be mobile. So we have mobile units that are actually going into the community and setting up ways so they're not always coming in and getting transportation. So it's a different public health model, but we really have to get on the ground for this type of an attack. It's the largest distribution of any vaccine in the history of this country. We got to try something different to make it work.
Now, this next question for both of you. With the delays in the vaccinations, is it because there is not enough vaccine being produced? And do you see this getting better?
Dr. Vasquez, you want to take that?
Yeah, well, the federal government hopefully will, you know, with the new administration, will try to push some of these things. I think, like we talked about AstraZeneca, J&J, these are all coming online. You know, they were all part of this warp speed. So they all built, they have a lot of supply. And hopefully that supply can get into, vaccines are not the solution, vaccinations are. So we're hoping as more of these come into the system that we start to see more flow. So I would think probably in the next quarter that we're going to see a floodgate where we'll get more of these vaccinations. And that's what I hope for. I don't know what you want to say, Dr. Snyder, but that's, I don't make this stuff, but if I made it, I'd be making a whole lot of it.
All right. The only thing I'll add is that, with each of these vaccines, there was a pre-purchase of 100 million doses already last year for the US. So there also been conversations recently about continuing to increase that number. So for Moderna, there's a chance there'll be 300 million doses for the US. For Pfizer, looking at, again, 200 million at minimum. There was 50 million purchased for 2020. The same is true of the other two, with the recognition that billions of doses by the end of the year for some of these vaccines for the world will be available. So to Dr. Vasquez's point, we expect the landscape of the supply to change dramatically in the next 3 to 6 months, which is a wonderful thing. And I can't continue to point out or celebrate or highlight the work that Dr. Vasquez is doing for all of us and teaching us all collectively, just the principle that no one will get this because someone tells them to. We have to understand rationales of why people are hesitant, and we as their physicians, it's our job. We work for them to get those questions answered. And so Dr. Vasquez lives that principle, and I hope we all continue to take that approach to every one of our patients that have questions on this complex topic.
Complex topic indeed. Doctors, final thoughts.
Dr. V, is it all right if I start?
Yeah, absolutely.
First of all, I'd like to, Samantha, thank you and the organization and Annette Pinder and Buffalo Healthy Living. I think these community conversations are really helpful. I've gotten a lot of good positive feedback from people that have listened to them, of stuff that they never knew, or it made them think about this differently. And without this venue, I don't think we would be getting to as many people as we do. So thank you, and I hope we continue to do it. Dr. Vasquez, I can't thank you enough for your partnership and what you do for our community. From my standpoint, it's an honor to serve Kaleida and the community and all the healthcare workers. Many of us are tired. The healthcare workforce is tired. It's been a straining year. We love what we do. We're energized by what we do, and we're going to get through this, but we're only going to get through it together. And I hope to see a lot more community engagement on the public health measures and necessities it takes for us to re-engage together as a society. And so thank you for allowing us to share the information today.
Yeah, I think on my side, the one thing is by 2030, we'll have 120,000 less primary care. So I think, COVID has given us an idea, especially in the Black and Brown community, that chronic diseases are very important. And if you don't have a tie-in to a doctor, those chronic diseases set you up to really, so if you have hypertension that wasn't well controlled, you have more receptors in the lungs, you get COVID more. If you smoke, you got more receptors, you get COVID. So all these conditions that if they were being managed by good primary care, we wouldn't have as many cases as we have right now. And that bond between primary care and the patient would make vaccination and testing a lot easier. So I'm just hoping that, the modifications of what happens in our communities, it's a lot of silos have broken. So we've got people that normally didn't work together, talk together, really all at the table. And I think that's positive. But again, trying to spearhead more primary care to be able to come, some of the primary care, I'm getting old. A lot of us are getting older. So you need that new line of fresh blood that sees this as an opportunity to really change communities. And COVID-19 is telling us that with good primary care, good access is how we get the best outcomes.
The 2 COVID-19 vaccines are safe and effective and have been vetted through clinical trials that included thousands of people. Potential side effects of the vaccine are mild, such as a headache, fever, or swelling of the injection site. According to the CDC, in very rare cases, allergic reactions may occur, but vaccination providers have medicine on hand to treat such reactions. Health experts say the consequences will be dire if not enough people get the vaccine, as it's society's best chance of recovering from the pandemic. If your loved one is hesitant to get the COVID-19 vaccine, please share today's show. I'm Samantha Latshaw. Thanks for watching. Stay safe and be well.